Okay, Doug, let's go to callers.
Let's head to Mesa, Arizona. And Doug, you're on with Dr. Wallach.
Oh, Doug, you're on the air.
Oh, Dr. Wallach, I appreciate your help.
Thank you. What's up?
Dr. Wallach, I have a lady that's 50 years old and weighs 215. She's 5'8". She was 5'7.5". She has patches of dry skin, and she's scheduled for carpal tunnel surgery here in 10 days. And she also has degenerative arthritis in her lower back, and now recently her knees and her hands joint pain. She's on cholesterol-lowering drugs. She's had her thyroid radiated, and she's on Synthroid. And she's had.
Okay, we got to run one of those message moments here. We'll be back with you in just a second. We'll just quickly recap this and go on to the next piece, and then I will give you an answer. We'll be back after these messages. And I want to talk to you a little bit about macular degeneration, the most common cause of blindness in humans and adults in America. And this is a fairly easy disease to prevent, certainly easy to reverse. Now, I was called a liar by a medical doctor in an audience, I don't know, gosh, it's got to be close to 10 years ago now. And I said, look, if you can give me 12 of your patients that are considered legally blind, if I could get half of them to read 20/20 in 90 days, would you apologize? He said, well, you could do 2 in 90 days, apologize. Make a long story short, he brought a box of 27 charts. I took all 27. And in 90 days, they could all read 20/20. Only 2 required glasses. 25 didn't need glasses. After being declared legally blind for 6, 8, 10 years. So it's actually, you have to change the diet, a life-changing experience. You have to change your lifestyle, and you supplement with all the known essential nutrients, and then there's a secret sauce that goes along with it. What I want you to do is get a hold of that CD called Seeing is Believing. As your Longevity Associate for the CD, Seeing is Believing. And the whole story's on there. This is actually the apology by the doctor who called me a liar during that meeting. He made me a CD called Seeing is Believing, and you'll just be amazed at what you'll learn on that CD and how to prevent and how to reverse macular degeneration. Okay, Doug, let's go right back to Arizona. And Doug, basically, I think I got 90% of all this poor lady's infirmities or infirmities. Would you run down them again so I just make sure I don't miss anything here? I start out with dry skin, carpal tunnel syndrome.
Yes, and she had her thyroid radiated.
Okay, low thyroid. She's got knee problems, back problems.
And she had an episode of atrial fibrillation. At that time, they put her on high blood pressure medication.
Okay. And she weighs 215. How tall is she?
She's 5'7.5". 5'7.5". She was
5'7"?
Yeah.
Okay. Yeah, even at 5'7", I'd like to have her lose 50 pounds. We can do that safely over a period of 3 to 6 months. And, of course, the AFib is actually, rarely is there anything wrong with the heart. Almost always it's a back problem. And you said she shrunk a little bit. Okay, she went from 5'8" to 5'7" kind of thing. Yeah. That's an indicator. And so let's get going here. She'd get rid of it. And when you have like 6 diseases like this, you're looking at a serious malabsorption problem. Does she have any history of skin problems? You know, any eczema, dermatitis, psoriasis, rosacea?
The patches of dry skin she has periodically.
Okay. Does she have any history of chronic constipation where she needed laxatives or fiber to have regular bowel movements?
No other gluten intolerant symptoms that I could find from her.
Okay, no symptoms. Okay, here we go. Got to get rid of all the bad stuff. No fried foods. Absolutely no fried foods. No exceptions. Absolutely no processed meats with nitrates and nitrites. No exceptions. All oils must go. No exceptions. That means absolutely no margarines, mayonnaise, salad dressings, cooking oil, canned fish got to be packed in water, mustard, tomato sauce, not oils. And let's just assume for a moment that she does not have a gluten intolerance, because other than she does have a lot of different diseases here, which is oftentimes a clue. But let's just assume she doesn't. What I want her to do is take 2 healthy bone and joint packs per month. That'll allow her to have 1 ounce of the Osteo FX Plus at breakfast and dinner. I want her to have 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner. 3 of the EFA Plus at breakfast and dinner. All that will be accomplished by the 2 healthy bone and joint packs per month. And also, there will be 2 large bottles of the 240-count glucogel, and that will allow her to have 15 capsules a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be accomplished by the 2 healthy bone and joint packs. And this will support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. This will support maintenance repair for the knees, the back, arthritis, carpal tunnel syndrome, all that kind of stuff. I'd suggest to her that she reschedule that surgery for 3 months down the line. Don't get the surgery. Also, the healthy bone and joint packs each come with a jar of the CM cream. She can put the CM cream on her wrist, both on the underside of her wrist and the sides and the top of her wrist, so she can get some anti-inflammatory and pain relief there. And then for her thyroid, I would have her take 3 of the Ocean's Gold 3 times a day, because she's a big girl. We're going to have 3 Ocean's Gold 3 times a day, 3 at breakfast, lunch, and dinner. That'll require 3 bottles a month, and this is the favorite food, if you will, of the thyroid gland. The high blood pressure, I would have her take the Ultimate Daily tablets. I'd have her take 3 times a day. That's 2 bottles a month of the Ultimate Daily tablets, and they're designed to support and promote healthy blood flow through even blocked arteries and support and promote healthy blood pressure. The atrial fib is actually not a heart problem. It's almost always a back problem, and degenerative disc disease, and the vertebrae get closer together as the discs shrink, and they begin to smash the roots of the spinal nerve that regulate the rhythm and the rate of the heartbeat. And when a person gets in a funny position, reaching around behind them, bending over, lifting up things, they'll set off an AFib attack. And we have to resolve the back problem. We have to support and promote maintenance repair of that back. And you'll find that this will reduce the risk of having another AFib episode. I would not let her get a pacemaker, a defibrillator. I would not let her get a ablation or a retroversion. I would not put her on the heart transplant list. That'll run up $500,000 for all those procedures, and it's not a heart problem. And so doctors should be put in jail if they do heart procedures on somebody with AFib. I think that gets it. Give me a call every couple of weeks. Give me a progress report. I want to know her blood pressure. I want to know her weight. Oh, I can make her lose weight faster if you want. This is something. This is something you have to look at in her budget. And if she wants to go faster, she can put 1 dropper full of the ASAP drops under her tongue 30 minutes before each meal. That'll require 1 bottle a month, and that 1 bottle a month will last and allow her to have 1 dropper full under her tongue. Don't let her swallow it. She's got to just hold it in her mouth. It will be absorbed through the tissues. If she swallows the dropper full, it will actually be digested and be pointless. And so I want to know her weight. I want to know her blood pressure. I want to know every piece of information you can give me when she calls back.